Each year, hundreds of thousands of people are released from U.S. jails and prisons without the necessary tools to rebuild their lives. That includes healthcare, resulting in dire outcomes for the recently released. But some states are hoping to fix that by enrolling incarcerated people onto Medicaid before they're released. To learn more about this, we turn to Ryan Levi, a producer for Tradeoffs, a national health policy podcast.
When someone leaves jail or prison, they're on their own pretty much to go and find their own new doctor, to get their prescriptions filled, to get their insurance. And these folks are also, at that same time trying to find a place to live, find a new job, reconnect with family and friends. There's a lot on their plate, and healthcare often takes a back seat.
According to a landmark 2007 study published in the New England Journal of Medicine, researchers found formerly incarcerated people were 12 times more likely to die than other residents. And that was just within the first 2 weeks of release.
And that's from things like cancer, suicide, cardiovascular disease. But the biggest issue is drug overdose. So these are real serious issues that gap in care. If someone has serious issues, serious health issues in jail or prison, and they are not able to get access to timely care once they leave, that can have deadly consequences.
But in April, the Biden administration offered new guidance for states to enroll justice-involved individuals in Medicaid before they leave incarceration.
That is basically a roadmap for states to say, hey, if you want to offer this coverage, if you want to provide Medicaid for people who are still in jail and prison, this is what we're looking for.
This comes after California became the first state in the nation to allow people held in jails and prisons to get onto Medicaid up to 90 days before their release. That's a big deal. Since Medicaid became law in 1965, the federal government prohibited states from spending Medicaid funds on people in jails, prisons, and youth detention facilities in nearly all circumstances.
It provides a bridge so that before they leave jail or prison, they have Medicaid. We know that they have insurance, and not just that, but they also have a doctor that they are connected with. They have an appointment set up. So it's not just, here's your insurance card. It's, hey, here, you're going to go see Dr. Smith on Tuesday at noon. And we're going to make sure that you are connected, that you have your prescriptions, that you have a doctor, and that you are not going to fall through the cracks. And so that is really what California is doing.
It's too soon to know the impact of California's decision to offer Medicaid to people prior to leaving incarceration. But at least 14 other states want to make similar changes to Medicaid, including traditionally red states like Utah and West Virginia. These changes may not be a silver bullet for all systemic social problems and disparities, but they could dramatically improve quality of life for hundreds of thousands of people upon release. Ryan recently met and interviewed one of them, a 62-year-old man named Lee Reed in San Francisco, who was released before California's Medicaid transition program was implemented.
He was homeless. He was sleeping on the streets for 2 nights in California. And like many folks who leave incarceration, he had multiple chronic conditions. He had diabetes, he had high blood pressure, and he also for years had agonizing back pain that he had been struggling with while he was incarcerated. The pain was so bad that he said, he often wondered if his life was still worth living because the pain was so bad and he just didn't see a way out. And so, he really struggled again with being able to not just get the health care he needed, but also all his other needs.
For 6 months, Reed frequently visited emergency rooms and used his walker as a blanket. He lived in a homeless shelter before finally undergoing back surgery. But without stable housing or income, Reed's life remains precarious and further exposes how many holes exist in the social safety net, especially post-incarceration.
Just getting someone Medicaid doesn't guarantee that they're going to get the care they need, and getting the care someone needs doesn't guarantee that they are going to have the outcomes, the broader outcomes that they want for themselves and that we as society want for them.
For the PBS NewsHour, I'm Laura Santhanam.